Welcome to the Weekly Dose, a Medscape exclusive where we break down the biggest social media stories and trending topics in healthcare. My name is Frank Cusimano, a third-year medical student and fourth-year PhD student and founder of Surviving Medicine, a podcast and social media platform dedicated to building a community and helping those in medical education. Today, I cannot be more excited to break down to you three topics that have been making waves across social media: health and nutrition. We're also going to cover the recent government shutdown, and we're also going to cover the measles outbreak. Welcome, guys, and I want to thank all of you who are watching today. If you have any questions throughout the segments about anything that we're talking about, make sure you send them in or write them in the comments. So 2 weeks ago, The Lancet published a seminal systematic review and meta-analysis of prospective studies and clinical trials on the relationship between carbohydrate quality and mortality on various chronic illnesses. Now, the study was funded by the World Health Organization, and they found that higher intake of dietary fiber and whole grains is associated with a decrease in risk of mortality and incidence of coronary heart disease, type 2 diabetes, and colorectal cancer. Now, the authors recommend increasing our dietary fiber to at least 25 to 29 grams per day, noting that metrics like the normal glycemic index and glycemic load, which we have all learned about, might be less useful as a measure of carbohydrate quality compared to fiber and whole grain content. Now, with the average American consuming less than 20 grams of fiber a day, that needs to be increased. And this study may actually influence public health policy and future dietary guidelines. Now, this comes at a time where nutrition research is largely under question, and many experts are calling for a restoration of respect to the field of nutrition. Now, this week, new research also from the Journal of Molecular Nutrition and Food Research published a Finnish study showing that men who ate at least up to one egg a day had a lower risk of developing type 2 diabetes than their peers. Now, egg consumption has remained very controversial, with many of the US studies reporting the opposite, and that high egg consumption is actually linked to higher risk of diabetes. Now, many experts are criticizing this new paper's claim that several bioactive compounds such as choline, which as you may know is high in eggs, have beneficial effects. Choline, as you may have known, is actually associated with an increased risk of prostate cancer, pro-thrombotic events, and pro-atherogenic conversion to TMAO. Now, my recommendation, I think most of the experts are agreeing, that additional studies are needed. So you may be asking, why are there so much info on these studies from eggs being good or bad? Which is it? I think we will find out as we get more research about the individual topic. So I want to take this and kind of think of the larger point, and that is that nutritional research has been under question for some time. Earlier this week on Medscape, Dr. Frank Hu, MD, PhD, summarized the issues in nutritional research, recognizing that there are a number of common recommendations that are seamlessly agreed upon amongst experts. Some of these include a lower fat diet, increasing your consumption of fruits and vegetables, and increasing your grain consumption. One of the issues with nutritional studies is the sensationalism and exaggeration that research findings are on the media and on social media. Now, there's no perfect method to measure diet in free-living populations, and experts must rely on multiple different methods of collection and analysis. And so most findings are relative, and research is an evolving process. And that's something that I think the public needs to remember and recognize. Contradictions in the literature is actually a healthy part of the process of science discovery and nutritional research. But it seems that the sensationalism only adds to the public's confusion over what to believe and who to trust. Now, these stories and any additional details are all available on medscape.com, so make sure you check them out at all the links that are provided. So if we don't have any questions for this topic, we're going to move right on to our second topic, and that is the US government shutdown. So it is day 34 of the US government shutdown. And before you roll your eyes, physicians and healthcare workers should be aware that the shutdown is not only affecting our patients, but is affecting us and the health of this country. Now, this week, 60 patient advocacy organizations and medical professional societies are calling Congress and the Trump administration to end the stalemate and reopen the federal government. The shutdown is preventing the FDA and the U.S. Food and Drug Administration from protecting Americans from harm and assessing the latest therapies. So the FDA is one of the few health-related agencies that is being affected from the shutdown. As of January 18th, only 37% of the FDA workers are actually being paid. Now, Commissioner Gottlieb has been very active on Twitter, and he has been working hard to keep many aspects of the FDA open, although only the high-risk food and surveillance inspections are being performed and some of the administrative tasks. Current available funding limits the agency's ability to perform any functions after February 11th. Now, the agency is no longer accepting new medical product applications, and many products and therapies in the pipeline are no longer being reviewed. And this is something that has been responded to by physician groups. The American Society of Clinical Oncology and the American Academy of Pediatrics have commented that the health and safety of Americans should never be weighed against the prospect of new life-saving therapies for our patients. So now you may be asking, what does this mean for physicians? Well, most food inspections are no longer being made. Patients are suffering. Medical products and medications that are not being reviewed include products that could treat and help patients with illnesses such as peanut allergies, patients with hepatocellular carcinoma, patients with osteoporosis, patients with triple-negative breast cancer, patients with Parkinson's disease, patients with multiple sclerosis, and patients with major depressive disorder. So what this means is there are a number of treatments that should be approved or are likely to be approved for those conditions, but they are not being reviewed and approved because of the government shutdown. Now, there is a question from our audience, from Raphael, and he asks, will a shutdown affect other countries too? At the moment, I don't know if it's affecting the health and well-being of other countries, but if the FDA and other medical organizations continue to be held up in advancing our understanding of science, and if any of the other, as it progresses through the end of February, if there are outbreaks for products that are leaving this country, we may not be able to inform other countries of illnesses or of outbreaks that we may not know about. So for a full list of links and articles, see the provided links on medscape.com that are also in the notes. So the final topic today that I want to cover is one that, to me, is a lack of physician communication. Now, this is on vaccines and the outbreak of vaccine-preventable diseases. 2018 was the second worst year for measles since 2000. Both Washington State and the officials of Portland, Oregon, have declared public health emergencies. Now, the WHO, the World Health Organization, has named the anti-vax movement a global health threat. To this day, it remains one of the most successful campaigns against one of the most effective public health interventions of all time, and that's vaccines. Now, communities are seeing a record number of non-medical vaccination exemptions, and according to the National Conference of State Legislatures, 47 states have provisions that allow parents to exempt their children from receiving a vaccine if it contradicts their religious belief. But the major issue is the 18 states that prevent the philosophical exemptions or permit the philosophical exemptions based on morale, personal, or other beliefs. Now, for physicians, let's look at measles specifically. Now, the MMR vaccine reduces the chance of contracting measles by 35 times. Measles is not just some spots on your face. No, measles is so contagious that 90% of people who are not immune become infected. Now, infection can occur simply by being in the same room as an infected person through respiratory droplets that can remain up to 2 hours after the infected individual leaves the room. Now, measles has no cure. So 25 to 20% of those who are infected end up hospitalized, and measles can cause serial illnesses such as pediatric encephalitis, and between 1 or 2 out of 1,000 that contract the illness actually die from it. Now, advice for physicians who encounter a vaccine adverse patient. Now, the American Pediatric Association has put out a number of different health topics and advice on how you can prevent or how you can talk to patients and parents about how to best overcome any objection to vaccinations. It is an ongoing discussion, and I think as we learn more and as physicians learn to craft that idea of communication, they'll be able to effectively provide more vaccinations to those who are concerned. But Frank, what about herd immunity? Isn't the collective immunity of the community at large enough to prevent the spread of vaccine-preventable diseases? Well, technically, yes. But many communities in those states have dropped below that critical threshold needed for herd immunity. And that level of threshold is different for every illness. So for measles, an example, you have to have at least 90 to 94% of all of the population vaccinated to prevent the spread of the disease. For a full list of the links and articles, make sure you check out medscape.com for the associated links. Thank you everyone for tuning in, and if you have any questions, make sure you leave it on the comments, and we will get back to you after the show.